All right, and good afternoon. Welcome back, everyone. I'd like to welcome and introduce our Executive Director, Dr. Robert Murphy, who is the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday and Thursday here on the Havey Institute for Global Health's Facebook page. And today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID news through today, the 15th of March. And we invite you to continue to submit your questions to us via Facebook at NU Institute for Global Health or via email at globalhealthinstitute@northwestern.edu. And I will be leading the discussion today. My name is Kristen. I'm the communications manager for the Institute. So Dr. Murphy, good afternoon. Thanks for joining us.
Hey, good afternoon. Good morning.
Well, diving right in, we've got some good news with the continued statistics that we're seeing. These numbers are looking great. Yesterday, it looks like we had just above 2,000 positive cases in the US. Our booster numbers were at 29%, staying a little bit there, but these cases continue to drop. So what can you tell us here about this good news, these numbers that we're seeing?
Well, this is the epidemiological wave. And you have to remember that the United States, very large country, 330 plus million people with multiple different regions, all sort of behaving differently and acting differently. So this is the whole country, as a whole entity going down. And that's great. And the big question is, how steep will this go down? And will there be a significant tail, or will there just be a rebound? So in places where there's cohesive mitigation strategies, someplace like South Africa, the cases go down almost to nothing. I mean, it really goes down to a very dull war. Things stay down, they loosen up, and then about 2-3 months later, they have another peak. And it's been pretty consistent with that approach, and they're not a very heavily vaccinated country. It's only 30% or something. The United States, we have the lowest vaccine rate of our peer nations in the high-income countries, and the use of mitigations varies significantly around the country. So what do we expect to happen? The pandemic's not over. The cases will go up. And where can we look? There's a couple places. One is that there's a new way to see if a pandemic is coming by measuring the amount of virus in wastewater. You may have heard of this. It's been in the news quite a bit. And there's sentinel projects around the country looking at virus in wastewater. And those numbers actually are going up in the United States. Now, the other thing is these waves don't happen globally all at the same time. South Africa typically goes first, Europe comes second, and then we come third. Asia's a little bit different story. So what's happening there? In Asia, they're having a big problem. China has locked down a couple of its areas, including a place near Shanghai that makes iPhones. They've locked down a province up by the North Korean border. Hong Kong has soaring number of cases and a very, very high death rate. Vaccine uptake in Hong Kong has been really bad. 40% of people have not been vaccinated, including many of the elderly. Here in the United States, as you pointed out, in the elderly groups, over 90% of people are vaccinated, and that's around the country. And that has really helped us quite a bit. But in Hong Kong, the elderly people are very suspicious, particularly with their sort of new government, the Chinese mainland government, sort of taking more and more control. And then to make matters worse, most of them got the Chinese Sinovac vaccine, which doesn't work as good as the ones that we were taking here. So there's a huge increase in deaths there, particularly in the elderly. So here, the elderly are mostly vaccinated, so our death rate is not as high. If you start looking in Europe, I think it's a little bit unnerving in that you're now seeing increases. Granted, they're not huge increases in Germany, the Netherlands, the United Kingdom, and Italy, all having upticks. So you're looking around the globe. You've got uptakes in Asia, New Zealand, Singapore, Hong Kong, even with the death rate in Hong Kong, China. You're having little upticks in Europe right now. In the United States, the number of cases continues to drop, but the wastewater virus is increasing. So what does that all translate to? It translates to enjoy yourself now because there's going to be another wave, and don't throw all those masks away. It's likely to come back. But again, to dampen the effect of these waves, and we'll see it in Europe first. Get vaccinated, get boosted. We know that helps.
Absolutely. And I think this serves as a reminder that the pandemic certainly isn't over. And like you said, now we're seeing good numbers, but it's important to get vaccinated. Diving into our headlines, speaking of what's going on overseas, what can you tell us about this Deltacron, this new variant that has been in the news over the last few days, containing genetic material from both Delta and Omicron that was identified in both Europe and the US?
So there's a couple things going on. There's the stealth variant of Omicron, BA2, and then there's Deltacron, which is kind of a merger of Delta and Omicron. We know more about the stealth Omicron, the BA2, and that's what's taking over in Europe right now. It is even more transmissible than Omicron by about 30%. But remember, Omicron was 300 to 600% more transmissible than Delta. That's why there were so many cases, because it's just so contagious. So Deltacron, very strange creature. It's like half Omicron, half Delta. There's numerous studies underway. Right now, data are too limited to say anything about this, whether it is more contagious or more severe or not. Remember, Delta was more severe disease than Omicron, but Omicron was much more transmissible. So it remains to be seen. There's very few, only a handful of people have really been infected so far.
Well, more to come on that, I'm sure.
More to come, for sure.
Fingers crossed it's good news. I know you already spoke on it a little bit, but let's talk more about China and what's going on there. This was in the news very heavily yesterday, battling their worst COVID outbreak for over 2 years. Cases doubled in just 24 hours. And there's an intense lockdown, shutting down millions of folks in millions of neighborhoods. What can you tell us more about what's going on over there?
Yeah, so China had a very different policy than many other countries. It was a very strict policy. And, this is a country where, you don't break the rules without paying, some huge price. And there's no like protesting individual rights there because they don't have any individual rights. So they reported 3,400 cases on Sunday. I mean, that's a drop in the bucket over here. But over there, they're up in arms. And they shut down schools, factories, as I mentioned already, an iPhone plant near Shanghai, and the urban area up by North Korea fully closed off. I mean, they shut it down. It is shut down. And they test everybody. They can test millions of people, in a matter of a week or so. And they do this. And so this is this policy they have. And then to make matters worse, their vaccines are not very good. So what happens is when a new wave comes in, even though they're heavily vaccinated in China, the vaccines aren't that effective. And so they tend to have these big waves and then things shut down. So China, as you know, is a huge economy. And so their economy suffers when they have these kind of shutdowns. So it's going to be a real lesson learned in how to deal with these kind of pandemics. if these rigid lockdowns, how good they are for controlling the pandemic. Because the same thing is true really about South Korea and New Zealand, and that, they had really strict lockdowns. They had Australia too. They had no cases. And then as soon as they tried to loosen up, even though they have high vaccination rates, they have a lot of cases. But because they're vaccinated with the better vaccines, they don't see that big uptick in death rate. So it's a real public health problem, and it's going to play out over the next couple months. But Omicron's not. I mean, COVID is not over.
Well, let's go and dive into some local news. It looks like Mayor Lori Lightfoot vows to enforce COVID vaccine mandates against police officers, against the police city employees, to be vaccinated against the coronavirus. What can you tell us about these requirements?
Companies, municipalities, legal entities can do this. There has to be out for people who can't take a vaccine for some reason. There are very few reasons, but there is a way to get out of it. But you can't just say it's against my religion, especially when your religion doesn't believe that. I think this is a good stand to take. The pandemic's not over. It's going to come back. People in the public have to not only protect themselves, but protect the other members of the public. And there's going to be another wave, as I just mentioned. It's already happening in Asia. It's already ticking up in Europe. We're already seeing it more in the wastewater in the United States, which is just a precursor for things to go up. People in these public jobs, I mean, we might as well, basically either get them vaccinated or get them out of the public sphere. If they can be accommodated outside of the public, that's up to a company or an entity, legal entity to do. But otherwise, they have to find some other kind of business that is not going to put them in the face of the public, because they're just going to be spreading it. And that's too dangerous to do. Who knows? What if the next variant, instead of being like Omicron, which was less severe, what if the next one is more severe? What if it's 2 or 3 times worse than Delta? And then, you're trying to vaccinate people in the middle of another peak. It really makes no sense. So I support the mayor's position, and any other company or entity, a public entity or whatever, government entity, where they're interacting with the public. In private, you can do what you want, but in the public, we have to think about the public health and your impact on other people.
Absolutely. Now, our last headline: Pfizer CEO says 4th dose of COVID vaccine will be necessary and has submitted this data to the FDA. What can you tell us about this 4th dose? When will it be required? Do we think this is going to be what we see here with all of our vaccines?
Yeah, this story has been floating around for months because the Israelis, who are heavily vaccinated and also have a big elderly population, noticed that all of a sudden a lot of people were getting COVID again. This is mostly more in the Delta period, and they kind of immediately approved the 4th dose. They saw that the antibody levels were down and that the patients were getting sicker, even though they were vaccinated, even if they were boosted. So they approved the 4th dose for elderly people. I believe it's age 60 and up, or if you have some underlying health issue. Sweden did the same thing, but it's people 80 years and older. The Scandinavians live a long time. They have very high longevity. So they did it in the 80 years. That was counting 80-year plus. So that was accounting for the most of the deaths. So they went by the clinical impact that was going on. Other places have it's kind of sporadic, but those are the 2 most public ones. So Pfizer is applying for the 4th dose. I think again in elderly and immunocompromised people, and I think that's, let's see the data. I'm not sure, but we can't vaccinate ourselves out of the pandemic. However, we can protect the most vulnerable from dying. And that's really the name of the game. We're not preventing illness anymore with these vaccines. You're going to get infected. They don't work that good in preventing new infection, but they do keep you out of the hospital, and they do decrease the death rate. So that's why we have to do it. And so we shouldn't get too upset about the infection rates rising, even in the vaccinated. That's going to happen because the vaccination rates, the vaccine does not protect much from that. Now, interestingly, Pfizer, who has applied for this fourth dose, is also doing a study of their vaccine versus a new version, a version 2.0 vaccine that's geared more towards the Omicron. And we'll see if there's any difference in the impact in that particular study. We have to do the science to figure out what's best. We can't just like make the rules up because we feel one way or the other. They are doing the right study. The problem now is there's so few cases that it's hard to do the study, but they're plugging away, and they think they have enough data to at least get approval for the fourth dose in very high risk patients with the original vaccine.
Well, more to come there.
Yeah.
Let's go ahead and dive into some viewer questions. First one, we have this family spent some time together, first time in a while. All adults were vaccinated and boosted, some children, however, under the age of 5. The next day, one of the adults tested positive with both the antigen and PCR tests. Their entire family then got sick, sore throat, headache for about 3 or 4 days. However, all of the family members that were with this adult that day tested PCR and antigen tests, and they have all come out negative. The only individual to remain testing positive is that original adult. Even the children were most likely sick, and they were feeling as though they were Omicron symptoms. They are inquiring how it's possible to have this exposure, even with some folks feeling ill, and however, only one individual testing positive. Are you able to explain a bit what might have happened?
You can't make the diagnosis based on symptoms. You have to have a test. So what it is you have a group of vaccinated people, somebody is positive, all right? They've probably got BA2, the stealth Omicron, most likely. But maybe it's just the regular one, but whatever. And that whole little subgroup of family members, they all become positive and they get sick. The other people in that circle don't get sick or don't get infected with COVID. Remember, the vaccinated people probably are not even spreading it as easily as unvaccinated. So the one unit gets infected, but the other units of the family are not infected. However, some of them get cough and cold-like symptoms. Well, it's wintertime. That happens, and that spreads around. So they're probably having two different types of infections. The ones that keep testing negative are probably negative. The PCR test, because now if they were just testing with the antigen test, I'd say, well, the test is not good enough. But they're having the PCR test. The PCR test is a molecular test. It tests just numbers of molecules. It's very, very sensitive test, and especially if it's repeated. So I think the one group who's testing negative has something else. And at some particular point, we're going to be able to answer their question, because of this program called RADx, Rapid Acceleration of Diagnostics for Coronavirus, which we're involved in, and is sponsored by the NIH. They're testing hundreds of companies doing multiple tests, and many of those tests are what they call multiplex tests. So they'll test for a lot of different things besides COVID. So they'll test influenza A, influenza B, respiratory syncytial virus, And ultimately, and some of them actually do a whole panel of respiratory viruses. Now, the more you test, of course, the more it costs, and and what can you really do, because most of these other things don't have a treatment for them yet, or a vaccine. So, but the technology is improving so much that I think the costs will really come down, and then these people will find out what they do have. It's probably just rhinovirus, which is the typical cold virus, which we can't test for, but it gets expensive doing all these tests. So the way it's set up, you're basically not encouraged to test because everything costs too much. But anyway, we'll figure it out at some particular point, because I think the test costs are coming down. But I don't think the group that's symptomatic with the negative test, I don't think they have COVID.
Well, that's good to know.
Yeah.
Now, our second question, we have an individual, a very general question. Thinking back to the very beginning of the pandemic, they're curious to know if you think it was ever possible to eradicate COVID fully, and if yes, how so?
This is a really good question. At the beginning, and the beginning is December 2019, at the beginning, we really thought that we could stamp out COVID, that we would just be able to squash it, vaccinate our way out, treat our way out, it'd be gone. Well, that didn't work. It's in the wastewater, it's in animals, it's in all sorts of people, and it's such a globally transmissible disease. I no longer think that it's possible to do that. I used to think that it was, and I probably said so publicly. So I apologize, and I just tell people I changed my mind based on the scientific evidence. I don't think we're ever getting rid of it. I think we'll get out of the pandemic because we're going to develop enough immunity from enough infections and immunity from the vaccines to get out of this thing. I'm pretty sure. And the treatments, Paxlovid is just the first good treatment. There's a pretty good uptake of Paxlovid. I was kind of surprised. They just started. It's not like when they approved that drug, this is the drug for COVID, you take it within 3 to 5 days of your first symptom, take it twice a day for 5 days, and it cuts the hospitalization rate, whether you had a vaccine or not, by 90%. I mean, that's incredible. And it doesn't matter whether it's Omicron or BA2 or anything, it works for all of them because it's a regular antiviral drug. So when the company got approval, it's not like you just click a switch and like millions of doses pop up. There's a whole supply chain, manufacturing, quality assurance, everything to get those drugs to market. But supposedly they've given out over 74,000 doses for a dosing, 5-day dosing period. There's 30 doses per 5-day treatment. It's 3 pills twice a day. So for 5 days, so it's 30 pills. So you do the math, and that's a lot of pills. Now, every month though, they can increase that, but logarithmically. It's not an arithmetic increase. They can ramp up to millions and millions of tablets if they want to. So that's another way to get out of this whole thing with the treatment. But it's got to be treatment early. You got to get it in the first 5 days. Ideally in the first 3 days. And actually in the administration's new COVID control plan, they have a test and treat strategy built in there somehow. I'm not familiar with the actual technical logistics, what they're proposing. But I mean, I think it's a good thing to do. And, they can propose all they want. The states have to do it. So the state of Illinois, and then Illinois is weird because we have then the city of Chicago. So the city of Chicago and the state of Illinois both have to agree to a test and treat strategy and get the pills ready. You get a system ready where a person who's diagnosed gets on that treatment real quick if they're high risk. All the studies have been done in high risk people. They're doing studies in lower risk people, but they're not done yet. It's approved in high risk. So that's going to help too. But you have to have the pills and be geared up to get the pills into the mouths of the people that are going to benefit from it.
Right. And instead of eradicating COVID, we'll just learn to live with it, learn to treat it. And that will be our new reality.
Well, it's very similar to what happens with malaria today if you live in Africa. I worked extensively in Africa until the pandemic. And, everybody basically walks around with a bottle of Coartem, which is the combo treatment for malaria. And, if you get a little headache and sweaty and you feel like you have malaria, you just pop your pills, or you get diagnosed and pop your pills, or over there, you kind of know if you have malaria and you just take your pills. And, that works. So, we can make it work for COVID too.
Well, for our final COVID question today, we have a question about long COVID. Are vaccinated and boosted folks still susceptible to getting long COVID if they get a breakthrough infection? Just curious to know if there are studies that show the percentage of unvaccinated folks who have symptoms of long COVID versus vaccinated. Is there anything you know about any studies going on that can kind of show the difference?
Yeah. This brings up a really important point. There's not only the acute infection, but there are a significant number of people that get long COVID. Define it how you want, 3 months, 6 months, whatever. But it can be disabling. And we don't know enough about it. It is being studied in multiple places around the world, and we'll learn more about it. People who've been vaccinated can get long COVID. The question is, what about children? Are children going to have long-term effects from this, even if it's a small percentage? We don't know. We don't know. So, so far, it's been shown that, yes, people who are vaccinated can get long COVID, but at a much lower rate than the people who were not vaccinated. So it's maybe half. We don't know, and we don't know if it's more severe or whatever, but it's less. So that's yet another reason to get vaccinated, and it's a very important medical problem that needs further study, and it is being studied.
Absolutely. Well, hopefully we'll have more to come in the next few months regarding long COVID. I know it's been in the news a lot, and the symptoms can be quite debilitating. So hopefully we're able to learn more. Well, that is all that we have for today, Dr. Murphy. So thank you so much. We'll be back Thursday.
All right. See you Thursday.